Hi, I'm Alexis Kliethermes, and I'm a first semester nursing student. It is November 4th, 2019, and it's 1:30 in the afternoon. And I'm going to be demonstrating how to do a urinary indwelling catheter on a female. So the first thing I would do is get all my supplies, which I've already gathered them all, and I would assess my patient, the last time they voided it, how much they voided it, the odor, the color, and all of that stuff. And then I will assess for the size of the catheter that my patient will be needing. So the first thing I'm going to do is do hand hygiene. I would check the patient's charts to make sure a doctor ordered the catheter to be inserted. And so next I will go into my patient's room. Hand hygiene in the patient's room. Hi, Mrs. Smith. Can you tell me your name and date of birth, please? Perfect. I'm Alexis, and I'm your nursing student today. We're going to put an indwelling urinary catheter in that was ordered by your doctor. Is that okay? Perfect. Right. Do you have any latex allergies or any allergies that you're aware of? No? Alright, can I get you anything before we get started? Alright, I'm going to get you laid back in supine position. At this moment, I'm going to pull the curtain for the patient's privacy. I'm going to go ahead and raise you up, okay? So working condition, that is good for me. Okay, that's good. Alright, so the first thing I'm going to do is pull the blanket down. Now I'm going to position my patient. I'm bending the knees. Put on the bed. Butterfly position. Put on the bed. Alright, now I would go ahead and pull the gown up. Hand hygiene. And then I'm going to go ahead and clean the peri area first. And since that's not a sterile procedure when cleaning, I'm just going to put regular clean gloves on. It's just not going to be today. Alright, the first thing I'm going to do is clean down your peri area, okay? I'm going to touch it just right around here. Swipe down the side and one down the middle. So now that I've done that, I could dirty some trash, having that cloth up in my gloves. I'm going to dispose of this. Do some hand hygiene. Now I'm going to get my kit on the bed and set it up. First thing I would do is open it. Alright, now I'm going to put this pad underneath them, making sure I'm only punching the corners and not contaminating the middle. So I'm going to put the shiny side to the bottom and put it underneath the patient's butt. Okay, hand hygiene. And now I'm going to go ahead and put my sterile gloves on. I'm going to open. Alright, the first glove I'm going to do is this one. Dominant hand. Pinky needle under the cuff. Okay. Now sticky under, giving my thumb away. Now I could adjust this. I'm not going to get close to the hand because that can cause contamination. My fingers all figured out. I'll get rid of that. First thing I'm going to do is set up my sterile field. I like this to be in the back and the catheter portion get close to up. So the first thing I'm going to do is attach my syringe. Okay, that's attached. Now I'm going to lube. And I would lube it 2 to 3 inches for a female. And there's already lube in here, so. Okay. Now I'm going to go ahead and clean the peri area on the patient. Okay. So my non-dominant hand is no longer going to be sterile after I touch the patient. There we go. And it just goes right there, and I'm still able to grab it. So at this moment, I'm going to go ahead and make this not be sterile anymore by touching the patient, pulling it apart. I'm going to swipe down, discard, swipe down, discard, and now for the last one, I'm going to swipe in the middle and discard. So now this hand is not sterile anymore. I cannot remove it off the patient or touch the catheter. Alright, Miss Smith, we're going to go ahead and insert your catheter today, okay? I'm going to need you to take a deep breath in just a second. I'm going to count of 3, okay? I'm going to have you take a deep breath and then do short breaths after that. 1, 2, and 3. So I'm going to insert it until I see urinary return. Making sure I'm not touching the patient with my dominant hand. Alright, I see urinary return. I'm going to go ahead and fill the balloon up, which I know there's 1,000 in this, and I'm going to make 10. So now I'm going to have to make sure when I document I put 10, so the nurse that removes this catheter knows how much to take out. So I go ahead and dispose of the syringe. I'll do a gently tug on this to make sure it's in place, and which it is. And now I'm going to go ahead and attach it to the patient's inner thigh, since it's a female leaving her room to maneuver and do all that. But now, since I'm going to be touching the patient, it's no longer sterile, so I can go ahead and remove my sterile gloves. I'm going to do hand hygiene. I can put clean gloves on now. And I already have my tape ready. Okay. We're almost done, Miss Smith. Attaching it to the inner thigh, leaving room for her to move. Now that it's attached, I will attach it to the bed linen, and then after that I will also attach it to the bed, making sure there's no loops. Making sure there's no loops, it's attached to the bed and the bed side. So now I could go ahead and clean up my area. Okay, Miss Smith, I'm going to pull this out from underneath your bottom. And at this time, I would clean her peri area to get with betadine if she would like, just to get the extra stuff off. And I could discard this, get rid of my clean gloves, throw those in the trash, hand hygiene, and put the patient's legs back down into a comfortable position for her. Pull her down, gown down, cover her up. Alright. I'm gonna lower your bed down, okay? Alright, so this position, I'm going to go ahead and raise the head of the bed. Put the call light and reach. Alright, Miss Smith, that completes the procedure of a urinary catheter that was ordered by the doctor. I'm going to give you this call light and let me know if I can get you anything, okay? So now that I have put the indwelling catheter in, I would go outside the patient's room and chart that I put it in, the gauge, and the size of the catheter, how the patient took the catheter, and if there was a sample of urine needed, I would go ahead and get that sent down to the labs for that, and then that's it.